Hello. Have you been feeling constantly tired, experiencing tingling in your hands or feet, having difficulty maintaining balance, or even noticing some memory loss? These could be signs of a vitamin B12 deficiency, which is exactly the topic of our video today. Vitamin B12 deficiency is more common than many people realize, especially in older adults. Research indicates that about 15% of people over 65 have laboratory evidence, detected through blood tests, of a B12 deficiency. This is quite concerning because, besides age, other factors can increase the risk of deficiency. For instance, if you take medications like omeprazole or pantoprazole, which are widely used to treat heartburn and acid reflux, or metformin, commonly prescribed for diabetes, your ability to absorb B12 might be compromised. Additionally, if you've undergone bariatric surgery or any other procedure involving the stomach, follow a vegetarian or vegan diet, or consume alcohol excessively, your risk also increases. The problem is that B12 deficiency isn't just a matter of low energy. It can lead to serious complications if not diagnosed and treated in time. These complications include dementia, neurological damage, anemia, and other conditions that, in many cases, may be irreversible. So, could you be deficient in B12? Stay with us until the end of the video to find out. But before we dive into the symptoms and causes of this deficiency, don't forget to like the video, subscribe to the channel so you won't miss our health tips, and hit the bell to get notifications for new content. And of course, share this video with your friends and family. Health information is definitely worth sharing because we all deserve to live the best life possible. Now tell me, have you ever been diagnosed with a vitamin B12 deficiency? What symptoms did you have? And if you started supplementing, did you notice any improvement? Where in the United States or the world are you from? Write it down in the comments below and help others learn more about this condition. One important thing that many people don't know is that the human body doesn't naturally produce vitamin B12. This means we need to obtain it from animal-based foods or supplements. Fortunately, most Americans get enough B12 from their diet. The main sources include dairy products, eggs, fish, meat, poultry, and seafood. So what are the functions of vitamin B12 in our bodies? It's essential for several biological activities, including DNA formation and regulation. It's crucial for the normal functioning of the brain and nervous system, and it's also involved in the production of red blood cells. Every cell in our body depends on vitamin B12 for metabolism because it plays a vital role in the synthesis of fatty acids and energy production. Additionally, B12 helps the body absorb folic acid, another essential nutrient. Just imagine, the human body produces millions of red blood cells per minute, but these cells can't be formed correctly without vitamin B12. That's why a lack of this vitamin can lead to megaloblastic anemia, a condition where red blood cells grow larger and become less efficient. Moreover, B12 deficiency has been linked to a variety of neuropsychiatric disorders. But who is most at risk of developing a vitamin B12 deficiency? Vitamin B12 deficiency can affect different groups of people depending on various factors. Let's explore the main risk factors in detail. First, advanced age. As we age, the body undergoes various changes that can affect the absorption of nutrients, including vitamin B12. With advancing age, the production of hydrochloric acid in the stomach decreases. This acid is essential for separating vitamin B12 from the food we eat. Without enough acid, B12 absorption is compromised. Additionally, aging can lead to other health conditions that exacerbate this issue, such as atrophic gastritis, which affects the stomach lining, further hindering absorption. Second, stomach or intestinal surgeries. People who have undergone bariatric surgery, such as stomach reduction, partial stomach removal due to ulcers or intestinal surgeries are at greater risk. These procedures can reduce the number of cells that produce intrinsic factor, a protein necessary for the absorption of vitamin B12 in the small intestine. Furthermore, the removal of parts of the small intestine, such as the terminal ileum, where B12 is absorbed, can also compromise the absorption of this essential vitamin. Third, chronic gastrointestinal diseases. Conditions like Crohn's disease, celiac disease, and atrophic gastritis can damage the lining of the stomach and intestines, which impairs the absorption of nutrients, including vitamin B12. These chronic inflammatory diseases can lead to widespread malabsorption, where several nutrients are poorly absorbed, further increasing the risk of B12 deficiency. Fourth, prolonged use of medications for heartburn and acid reflux. Proton pump inhibitors, such as omeprazole, pantoprazole, and histamine 2 blockers, such as famotidine, cimetidine, are widely used to treat conditions like heartburn and gastroesophageal reflux disease. While effective, these medications reduce gastric acid production, which is essential for B12 absorption. Long-term use can lead to chronic B12 deficiency, increasing the risk of long-term complications. Fifth, use of metformin. Metformin is a common medication for treating type 2 diabetes and polycystic ovary syndrome, PCOS. However, studies show that prolonged use of metformin can interfere with the absorption of vitamin B12 in the intestines. This effect can be subtle and take years to manifest, but over time, it can lead to deficiency symptoms. Sixth, autoimmune diseases. Some autoimmune diseases, such as pernicious anemia, lupus, and Graves's disease, increase the risk of B12 deficiency. In pernicious anemia, for example, the immune system attacks the stomach cells that produce intrinsic factor, which is essential for B12 absorption. Without this factor, even a B12-rich diet won't be enough to prevent deficiency. Seventh, alcoholism. Excessive alcohol consumption not only damages the liver, but also affects the body's ability to absorb vitamin B12. Alcohol can cause inflammation and damage to the gastrointestinal lining, resulting in malabsorption. Additionally, individuals with alcoholism often have poor diets, which exacerbates the risk of deficiency. Eighth, vegetarian or vegan diet. People who follow strict vegetarian or vegan diets are more likely to develop a B12 deficiency, as this vitamin is mainly found in animal-based foods. For those who don't consume meat, dairy, eggs, or seafood, B12 supplementation is essential to prevent severe deficiencies. Ninth, conditions that interfere with nutrient absorption. Medical conditions that affect nutrient absorption, such as short bowel syndrome, often following surgery to remove part of the intestine, can also lead to vitamin B12 deficiency. Patients with these conditions should regularly monitor their B12 levels and discuss supplementation strategies with their doctors. And what are the symptoms of this deficiency? They can vary, but some of the most common include symptoms of vitamin B12 deficiency can be subtle and progress slowly, which can lead to a delayed diagnosis. They affect multiple systems in the body, and the severity of symptoms may depend on how severe and prolonged the deficiency is. First symptom: weakness, fatigue, or dizziness. These are often the first symptoms noticed and are usually caused by megaloblastic anemia, a condition where the body produces large and ineffective red blood cells. Anemia reduces the blood's ability to carry oxygen, resulting in constant fatigue, a feeling of weakness, and occasional dizziness. Second symptom: tingling or numbness in the hands, legs, or feet. B12 deficiency can lead to damage to peripheral nerves, resulting in sensations of tingling, numbness, or a pins and needles feeling in the limbs. This symptom is particularly concerning because it can be irreversible if not treated in time, affecting mobility and coordination. Third symptom: difficulty walking and balance. Problems: prolonged B12 deficiency can affect the central nervous system, leading to coordination and balance issues. People may begin to have trouble walking, feel unsteady when standing up, or struggle to maintain balance on uneven surfaces. Fourth symptom: pale skin. The megaloblastic anemia caused by B12 deficiency can leave the skin looking pale or yellowish, a condition known as mild jaundice. This happens because the large but ineffective red blood cells are more likely to be destroyed, releasing bilirubin into the blood. Fifth symptom: swollen and inflamed. Tongue. A swollen and red tongue, known as glossitis, is a classic symptom of B12 deficiency. The tongue may become tender, smooth, due to the loss of taste buds, and sore, which can make eating difficult and cause discomfort when consuming food and drinks. Sixth symptom: palpitations and shortness of breath. The lack of healthy red blood cells can lead to heart palpitations, increased heart rate, and difficulty breathing, especially after physical exertion. These symptoms arise from the heart needing to pump more blood to meet the body's oxygen demand. Seventh symptom, digestive problems. B12 deficiency can cause a variety of gastrointestinal issues, including constipation, diarrhea, loss of appetite, and excessive gas. These symptoms can be mistaken for other digestive conditions, which may delay the correct diagnosis. Eighth symptom, muscle weakness. The lack of vitamin B12 affects the energy metabolism of muscle cells, which can result in generalized muscle weakness. This can impact the ability to perform daily tasks and compromise quality of life. Ninth symptom, vision loss. In severe cases, B12 deficiency can damage the optic nerve, leading to blurred or double vision. This condition, known as optic neuropathy, can be irreversible if not treated properly and may progress to significant vision loss. 10th symptom, mental problems. Vitamin B12 is essential for brain health. Its deficiency can lead to a range of neurological and psychiatric problems, including memory loss, difficulty concentrating, depression, irritability, and even drastic behavioral changes. In extreme cases, B12 deficiency can be mistaken for dementia, especially in older adults. To diagnose B12 deficiency, doctors usually measure the levels of this vitamin in the blood. However, up to 50% of patients with subclinical deficiency may have normal or borderline B12 levels. Therefore, more sensitive tests, such as measuring methylmalonic acid and homocysteine levels, may be necessary for an accurate diagnosis. And how can you prevent this deficiency? If you don't consume animal products or have a medical condition that interferes with nutrient absorption, consult your doctor. They may recommend B12 supplementation orally, sublingually, or even through intramuscular injections. And if you're worried about the risk of taking too much B12, rest assured, vitamin B12 has a low toxicity potential, and even in high doses, it's considered safe as the body doesn't store large amounts in excess. Did you enjoy the video? Then don't forget to like, subscribe to the channel, and share this information with your loved ones. And now that you know the importance of vitamin B12, tell me, have you ever had a B12 deficiency or do you take supplements? I'd love to read your comment. And always remember to consult a healthcare professional for personalized advice, especially if you have pre-existing medical conditions. And which video will you watch next? I'll share 3 relevant recommendations that appear for you. My video on the 10 proven benefits of eating chia seeds every day, my video on eggs, are eggs good or bad for your health, and my playlist on the best foods to fight fatty liver and much more. Thank you so much for watching until the end. Keep an eye on the symptoms of B12 deficiency that should never be ignored. May God bless us with health and life. Let's work together to promote everyone's well-being. Don't forget to subscribe to the channel and like the video. See you in the next video.